sense in looking down.
Ain't no sense in looking down.
Ain't no healthcare on the ground.
Ain't no healthcare on the ground.
Whoa!
Whoa!
Hold your head and hold it high.
Hold your head and hold it high.
The living wages on the rise.
Every day we know that our children are in desperate need of health care reform and health care coverage. And we stand here today for them. Let me hear you on that. Yeah! Here in Dauphin County, there are almost 3,000, just think about that, just in this little county in central Pennsylvania, almost 3,000 children enrolled in the state children's health insurance program last year. Approximately 11% growth from the year before. It is not okay for our children not to have health care. Being proud of increasing enrollment to cover children's health care. That is a shame on this country, a shame on the state. We should have health care for all, and we should take care of our children.
Thank you.
I care for children who come from families who have working parents where their jobs provide health care. But I also care for many children who just aren't as lucky. I see children coming into the hospital with stage 4 cancer whose parents work but do not have jobs that provide health care. They don't see a pediatrician for regular preventative physicals because it is just too expensive. They end up in the hospital with late-stage cancer that could have been caught much sooner. These patients don't come in with a good prognosis, although they could have if their cancer had been caught by a pediatrician doing regular preventative care.
We know that health coverage for children is inexpensive. We know that prevention as well as early identification and treatment saves health care dollars. And we know that giving every child a chance for healthy growth and development ensures a positive future for the Commonwealth. Penn State Children's Hospital recognizes that neglecting children's health in the present will result in higher human and financial costs later. Reauthorization and full funding of the state children's health insurance program makes good fiscal sense and is the right thing to do.
Well, look, this is a very simple debate we're having. It's not complicated. This legislation is about the American family. It's about children, and especially their parents. So many parents who worry about, they go to bed at night worrying about a lot of things, paying the bill, making the mortgage payment, making other payments, but they worry mostly about health care for their children and for their families. Mr. President, we ask him over and over and over again, don't veto health insurance for 10 million American children. Don't do that. But I'll tell you one thing. If President Bush uses his veto pen to veto legislation for 10 million American children, the United States Senate is going to override his veto.
Healthcare!
When do you want it?
Now!
What do you want?
Healthcare!
When do you want it?
Now!
What do you want?
Healthcare!
When do you want it? My name is Noah Williams-Morrill, and my mom and dad can take me to the hospital whenever they want because they're part of the union, and I wish all kids could have that care too.
Here's the bottom line. We don't need any more conferences. We don't need any more studies. We don't need any more discussion about health care. What we need is action. And we need it now. And as Senator Casey and Dr. Paz said, this is not a very complicated issue anymore. If having health care for children is complicated, something is fundamentally wrong in America. And so here's the problem. This is not about policy anymore. It's simply about politics and leadership. And we need to say to President Bush, there's lots of things in America, as the Senator said, we may not agree on, but God willing, Mr. President, sign the bill. Let's tell the President, sign the bill!
Sign the bill! Sign the bill!